Hi everyone, welcome back to my channel. So today's video is going to be about the pathophysiology of the brain. We're going to go over the different brain lobes and their functions. So it should be a quick and brief video, but as you guys know, I am a diehard believer that if you know pathophysiology, you will understand when we go over different neurological issues, because when you know what's good and what's normal, for the body, when a patient presents with symptoms, you'll know that there's something wrong, because obviously that's not the norm. Okay, so that's why pathophysiology is so important to know before you go into like med search and diagnosing a patient. So if you already know me, welcome back to my channel. For those that are new, my name is Gabby. I'm an ER nurse, and I'm also a student getting my nurse practitioner acute care license, and I just love teaching as my hobby. So let's begin by just overviewing the brain. So like I said, the brain has different parts to it. So there's different lobes, and each of these lobes have a different function and job. So when a patient presents with a symptom, if you know what each lobe works like towards, or like what the job is when a patient presents with something, you'll kind of know like where the patient is having issues in their brain because of what they're presenting, like, because you know the norm of the brain. So you know that the frontal lobe is going to do this, this, and this. So if you see that the patient is not performing those things, then you know, okay, something must be wrong with this patient's frontal lobe. So this is why I am so on top of you guys at Patho. I know that it's hard, but once you get used to it and learning and understanding it, I'm telling you that once you go into like med search and you start learning about diagnosis and diseases and stuff, it's going to click even easier because you know your pathophysiology. So I wanted to start off with the frontal lobe because this is one of the biggest lobes that they ask you about because of two specific areas. So overall, the frontal lobe plays a role with your personality, your behavior, and your mood. Also with your emotional regulation, concentration and reasoning, problem solving, and planning and organization. Now, as you can see indicated in the PowerPoint, you have your Broca's area, which is this little spot that's highlighted right here in red. And this area controls your expressive speech. So I emphasize expressive because I want you guys to know the difference between expressive and receptive speech. Okay, we receive information and we also express information. We express words and receive words. Okay, we're going to be talking about receptive information with another part of the brain, but I want you guys to know that your Broca's area is your expressive speech. It's what you put out to the world, the words that you put out, what you express. Remember, express is in there. How you express your feelings, how you express anything that you want to say is your expressive speech. So if we're having a conversation and you're trying to tell me, so you're thinking, okay, I want to tell Gabby that I'm scared about my exam, right? But you're thinking about it, but you see that you can't verbalize it. Something's going on with that area of your brain. So that part of the brain is broken. Your Broca's area is broken when you are not able to express yourself. Okay? Now, your primary motor cortex is another part of the brain, another part of the frontal lobe, and this one controls your voluntary movement. So like I am emphasizing on voluntary because we have your voluntary and your involuntary movements of your body, right? So your voluntary is, if I want to raise my right hand up, I'm going to do it. So you're sitting there, try to raise your right hand up. You have no issues doing this whatsoever, correct? But you might have a patient presenting to the emergency room telling you, all of a sudden, my whole entire right side, I can't move it. I want to move my right arm and I can't. I don't know what's going on. So that should ding you like, oh, okay, there might be an issue with the primary motor cortex of this patient. So this part of the brain controls your voluntary movement, okay? Not your involuntary, which you don't control, your voluntary, the ones that we typically control, okay? So for your exams, make sure that you know those two areas. You might get like a scenario that a patient arrives and is telling you, or you're doing an NIH and you see that the patient can't speak to you, but they're following commands. So you know that maybe that's the Broca's area or that's the frontal lobe. They might ask you one or the other. So if you have like a scenario like that and you see in the answer choices that Broca's area doesn't pop up, but the frontal lobe does, then you know that that's the right answer, because the Broca's area is within the frontal lobe. It's not anywhere else in the brain. It's inside the frontal lobe, okay? Now, our temporal lobe is right next to our frontal lobe, so it's right there. So this is basically typically where your ears are going to be. Like if you think about a skull, like our head, our ears are going to be in like some part of this region, right? So I want you to think about that, because a temporal lobe it works with your hearing. So that's one thing that I've always thought about, like the temporal lobe is right next to my ears, so that's the one that controls my hearing and attention. It also plays a role with balance, but not 100%. So it does not control your balance 100%, but it does play a role to it, and we'll talk about that next. It also stores verbal and visual memories, short and long-term memory, and it also has to do with understanding language. So when you're learning different languages, when you're growing up, that's your temporal lobe working. Okay, the reason why I wanted to talk about this one next is because just like the frontal lobe, we have a specific part of the temporal lobe that you will be tested on, and it's called the Wernicke's area. And like I said, we have a receptive speech. So this is what the words that we're receiving. So if we're having a conversation, everything that I'm talking to you about, you're receiving that information and you're understanding it, correct? Now, when a patient, let's say you have a patient, they arrive to the ER, the family member says that the patient had altered mental status, wasn't verbalizing themselves, but then they were also talking to them and they were kind of lost. And you do your NIH and you tell the patient, can you please tell me your date of birth and your full name? They're unable to talk to you. Okay, so maybe they're having some expressive issues. But then you tell the patient, can you lift your right hand? And they're not doing it. So they're not receiving the information that you're telling them. Because if they were, they will follow commands, right? So that's one part of your NIH, which I'll make another video in regards to NIH, because I want to kind of dig deep into that, and that will go into it when we start talking about strokes. But I just want you guys to understand that Wernicke's area is your receptive speech. If a patient is not receiving the information that you're speaking and not understanding what you're telling them, and they speak English or they speak the language that you speak, and you see that they're not receiving that information, there's something going on with that area of their brain. And then, like I said, this is also the area where you comprehend language. So if you speak English and Spanish, if I speak to you those two languages, you should be able to comprehend. But if I all of a sudden talk to you in Chinese, you're obviously not going to comprehend, because you haven't learned that language. So your temporal lobe has no idea what you're talking about. And that doesn't fully necessarily mean that the Wernicke area is not working, because there's thousands of languages that we could learn. But we specifically have, our own languages. So for example, I only know English and Spanish. So if you talk to me another language, I wouldn't be able to communicate with you or understand you, because I have not learned that language, and that's okay. But that doesn't necessarily mean that my Wernicke area is not working. So just keep that in mind when you're doing test questions, and also in the clinical world. You want to make sure that you know what languages your patient speaks, because maybe the patient comes in and you're trying to speak to them in English, and they don't speak that language. So regardless of the fact if they have an issue with receptive speech or not, you're not testing them 100% accurately because you're speaking to them in a language that they are not aware of. Okay. Now, your brainstem. Your brainstem is so vital for like life in general. And it I wanted to show you guys some exams that we do. I know it's not patho related, but I did want to bring it into our lecture. So our brainstem has like the midbrain, the pons, the medulla, the spinal cord as well, and then this whole entire thing is like the brainstem, right? So, and the thalamus. So this whole entire little brainstem takes care of your consciousness, your breathing, and your heart rate. So you could already see how important this little area of your brain is. Okay, so in the ICU, or when a patient is trying to be tested to see if they're brain dead, we do different exams. So we don't do only just one exam, of course. We have to do all of these exams to physically say this patient is completely brain dead. Okay, just because they fail one doesn't mean they're necessarily completely brain dead. You have to do all of these exams, and then that's how the doctor will determine if the patient is brain dead or that the brainstem is dead. Okay. So here we have that they palpate and they touch the facial area to see if the patient reacts to anything. Here we could get like a cotton swab or anything that won't cause any abrasion to the eye, and like poke the eye to see if there's any reflex. Here, if you think about like Perla, we're looking at the reaction to the light. For the like if the eyes react to any of the light. This one is very cool. So they get like very cold water and they flush it inside the ear, and the normal sign that you will get from a patient that is not brain dead is that their eyes will shift and try to look at the ear that cold water is being infused in. So if they are brain dead or that part of the brainstem is not working, they're going to just keep looking forward and you're not going to see their eyes shift anywhere. And then lastly, they'll do a swallow and gag reflex to see if the patient still has that reflex. Now, your cerebellum is the one that plays the 100% part of your balance and coordination. So if your patient is having balancing problems, unable to walk, there might be something going on with their cerebellum, which is right here in the back. A lot of patients present with benign tumors that are causing them to have issues with balance, and they're usually located in this area compressing the cerebellum. The cerebellum also works with the sense of movement, action, and location of your body. So when you do like also like on a stroke patient, the NIH, one of the parts of that is like to know if the patient is having extinction to one side of the body, where the patient basically forgets that they either have a right or the left side of the body and just ignores that part completely. And then it also works with your posture and your movement. Then we have the occipital lobe. This one is pretty easy to remember. Just think about O, which is ocular, O for ocular, and the occipital lobe is in charge of your visual system and your information, like the visual information that you see, and perception of shapes and sizes. And then we have our parietal lobe. So our parietal lobe is located right next to the frontal lobe, and this one works with calculations, attention, body awareness, which is your perception, and the most important one that you want to know for exams is sensory. So it is very important to know that the parietal lobe is the one that works with temperature control, pressure and touch, smell, pain, and taste. And I did a typo. That is not how you spell taste, but this part of the brain is one of the lobes that, like, when you're learning pediatrics, or if you have a baby and you buy like toys with textures and different feels, like fuzzy and soft and, you know, rough or whatever it is, this is the lobe that you're basically building up on. So you're learning how to feel different textures, and also when they're eating, they're they're tasting different things, etc. So for your exams, make sure that you know that the parietal lobe is the one that deals with your sensory, and temperature, pressure, and touch, smell, pain, and taste are very important to know. And that is it for this little quick pathophysiology of the brain. Like I mentioned before, if you guys have any questions, please, please, please don't be shy. Comment down below. If you want a quicker answer, you could feel free and check out my Instagram. You could message me. Sometimes I take a little bit on Instagram to text sometimes or DM you guys because I'm either working or I'm in school or I just have so many messages to get to. So if anything, just comment down below and message me there, and I will respond to you as quick as possible. And I hope you guys learned a little bit with this video. Leave any feedback as well. Like I said, I do this for you guys. So if you guys have any feedback, anything that you guys want me to go over, make videos about, don't be shy. I love getting feedback from you guys. So yeah, and don't forget to subscribe. When you subscribe and you hit the bell icon, it will give you a notification when I post again. Bye guys.